Can you tell me what are the four basic tissues that are present in human body? Yes, one is epithelial tissue, then we have connective tissue, then we have muscular tissue, and finally we have nervous tissue. And we know that the nervous tissue in human beings is organized into a central nervous system and peripheral nervous system. The central nervous system includes brain and spinal cord, whereas peripheral nervous system includes a network of nerves referred to as cranial nerves and spinal nerves. The brain and spinal cord acts as the master control of each and every organ present in the body, and they control these organs through these cranial nerves or spinal nerves. In this session, let's learn more about these cranial nerves and their functional components. The learning objectives for this session are, by the end of completing this session, you should be able to define and list the cranial nerves. What are the 12 pairs of cranial nerves that we have? Then, classify them into sensory, motor, or mixed. Then, identify their attachment to the inferior surface of the brain or base of the brain. We need to know about every cranial nerve, where exactly it originates from the inferior surface of the brain. Then, we will discuss about identification of different foramina of the skull through which these cranial nerves either enter or exit. Then, you need to describe the development of the functional columns of cranial nerves. Then, describe the nuclei that are associated with each of these functional columns, and then identify the location of these cranial nerve nuclei and functional columns within different parts of brainstem. With these learning objectives, let's begin. Let's talk about cranial nerves now. Now, as I said, the brain and spinal cord will control each and every organ or tissue in the body through a network of nerves referred to as cranial nerves or spinal nerves. Now, how do we define cranial nerves? This is an image showing the two important components of central nervous system. So what do we have here? We have the brain with its different parts, and then we have the spinal cord. This is the spinal cord. Now, what exactly are cranial nerves? Remember, cranial nerves are those nerves which are attached to the brain. Could be different parts of the brain, right? We are not worried about whether it is attached to forebrain, midbrain, or hindbrain, but all the nerves that are arising or that are attached to brain, these are referred to as what? These are referred to as cranial nerves, right? These are cranial nerves. Similar to that, when we have nerves arising from the spinal cord, we refer this to as the spinal nerves. In human beings, we have about 12 pairs of cranial nerves, whereas at the same time we have about 31 pairs of spinal nerves. This is regarding the definition of cranial nerves. So I want you to remember, cranial nerves are the nerves which are attached to brain, different parts of the brain. Right, once we have learned this, let's learn few important facts regarding the cranial nerves. Now remember, we have how many pairs of cranial nerves? We have 12 pairs of cranial nerves, and these are numbered using the Roman numericals 1 to 12. So remember, whenever you represent cranial nerves, you always have to represent in Roman numericals. Right. Now the question is how the cranial nerves are numbered from 1 to 12. What is the basis for this? Remember, cranial nerves are numbered based on their attachment. Now, attachment to where? Remember, attachment to the inferior surface of the brain, right? Based on their attachment to inferior surface of the brain, these are classified as 1 to 12. How exactly? The most anterior cranial nerve is referred to as cranial number 1. Then the most posterior nerve to be attached in the inferior surface of the brain is referred to as cranial nerve 12. So cranial nerves are numbered from anterior to posterior based on their attachment to the inferior surface of the brain, right? This is regarding their attachment and how they are numbered. Then cranial nerve 1 and cranial nerve 2. That is olfactory nerve and optic nerve. Remember, these are attached to forebrain. These are attached to forebrain. Then starting from cranial nerve 3, that is oculomotor nerve, to cranial nerve 12, that is hypoglossal nerve. All these are attached to brainstem. Now, can you tell me what is brainstem? Brainstem includes midbrain, pons, and medulla oblongata. Right? We will discuss where exactly cranial nerve 3 to 12 are attached to different parts of the brainstem. But remember this important fact: 1 and 2 are attached to forebrain, and then we have 3rd to 12th cranial nerves which are attached to brainstem. Now, one more interesting fact is a nerve called as Nervi terminalis. Right? There is a nerve called as Nervi terminalis which is closely related to the olfactory pathway. This is almost referred to as the 0th cranial nerve. Now, sometimes they ask you this in Viva. Which nerve is called as the 0th cranial nerve? Right? So remember, it is Nervi terminalis. Similar to this, we have something referred to as 13th cranial nerve. And which is the 13th cranial nerve? Remember, the nervus intermedius. The nervus intermedius, or otherwise referred to as the sensory root of facial nerve. This is sometimes referred to as the 13th cranial nerve. Now, these are some of the facts that are important for your Viva examination. Otherwise, remember, the total number of cranial nerves that we have in the human body are 12, numbered from 1 to 12. Right. Once we have learned this, let's see how exactly the cranial nerves are classified. The cranial nerves are classified as sensory. Right? We have sensory nerves. What do we mean by this? The main function or the chief function of these cranial nerves is carrying sensation. That's it. Right? They do not involve in any other function. So these are referred to as purely sensory cranial nerves. Similar to that, what we have is, we have motor nerves. Right? These are purely motor. Right? These are purely motor cranial nerves. And then we have a mixture of these two functions, which are referred to as mixed cranial nerves. Now, 1 to 12 cranial nerves, how exactly are they grouped into these nerves? Now, to remember this, we have an easy mnemonic. Let's try to write it down. Okay? Now, this mnemonic goes like this. Some say marry money, but my brother says big brains matters most. Now, this is the mnemonic that we can use to remember the classification of cranial nerves. Now, let's try to write it down. So, we have the first cranial nerve, the second, we have the third, then we have the fourth, we have the fifth, sixth, we have seventh, eighth cranial nerve. Here we have the 9th, 10th, 11th, and 12th. Now, how to remember now? Remember, S stands for sensory. Right? S stands for sensory. B stands for both, which means it is a mixed nerve. Right? And M stands for motor nerve. Right? So, what does this mnemonic say? The first cranial nerve or olfactory nerve is sensory. Optic nerve is sensory. The third cranial nerve, which is oculomotor, is purely motor. Then we have trochlear nerve, which is purely motor again. We have trigeminal nerve or the fifth cranial nerve, which is a mixed cranial nerve. Then we have the sixth cranial nerve or the abducent nerve, which is again a purely motor nerve. We have the seventh cranial nerve, which is mixed. We have the eighth cranial nerve or the vestibulocochlear nerve, which is purely sensory again. Then we have the glossopharyngeal nerve, which is mixed. We have the vagus nerve or the 10th cranial nerve, which is mixed again. Then we have the axillary nerve, which is purely motor. And finally, we have the hypoglossal nerve, which is purely motor again. This is a mnemonic which you can use to remember the classification of the cranial nerves. So can we regroup the cranial nerves into sensory, motor and mixed nerve? So based on this, we have the olfactory nerve, which is sensory, purely sensory. Then we have what? The optic nerve. And which is the next sensory nerve? We have the 8th cranial nerve, that is the vestibulocochlear nerve. And anything else? None, right? So these three are the pure sensory nerves. Now similar to this, let's talk about, or let's list the motor nerves. So the first motor nerve we have here is the oculomotor nerve. Then we have the trochlear nerve, right? Then we have the abducent nerve or the 6th cranial nerve. And then we have the 11th and the 12th cranial nerve, which are axillary nerve and hypoglossal. So we have the 11th and we have the 12th, right? Then let's talk about the mixed cranial nerves. The mixed cranial nerves begin with the trigeminal nerve, right? We have the trigeminal nerve, and then we have the 7th cranial nerve or the facial nerve. And apart from this, what we have the 9th and 10th nerve, that is glossopharyngeal and vagus nerve, right? This is how we can remember the classification of cranial nerves, right? They are classified mainly into, remember, sensory, motor and mixed, and use this mnemonic to remember the classification of these cranial nerves into sensory, motor or mixed. Some say marry money, but my brother says big brains matter most, right? This is regarding classification of cranial nerves, right? Once we have learned this, we need to know where exactly these cranial nerves are attached to the inferior surface of the brain, right? In the beginning, we said that the first two cranial nerves, which are the first two cranial nerves, the olfactory nerve and the optic nerve, where they are attached to forebrain. So let's try to identify them. The first cranial nerve is seen partly here. In fact, this is not the first cranial nerve, but this is the tract associated with the first cranial nerve. Remember, the first cranial nerve is olfactory nerve and it pierces the cribriform plate of ethmoid, forms the olfactory bulb and olfactory tract, and this is the olfactory tract. Fine. So we will name this as the first cranial nerve or the olfactory nerve. Now again, remember, this is not the true nerve. This is the olfactory tract, which is formed by the union of number of olfactory nerves. Right. This is regarding the first cranial nerve. What about the second cranial nerve? Now, if you come slightly behind, can you see this? This is the optic nerve, right? The second cranial nerve or the optic nerve. So what we have done now, we have the inferior surface of the brain in which we identified the first two cranial nerves which are attached to the forebrain, right? Then we also said that cranial nerve 3rd to 12th are attached to different parts of the brainstem. Now, what are the different parts of the brainstem? Let's try to identify them first. Here we have the midbrain, that is the cephalic portion of the brainstem. And what we have here, this is the pons, right? And what we have here, this is the medulla oblongata. Now, let's try to understand the attachment of the last 10 pairs of cranial nerves to different parts of the brainstem. Remember, the next cranial nerve we have is what? The 3rd cranial nerve, also referred to as oculomotor. Right? Now, where exactly the oculomotor nerve is attached? Remember, oculomotor nerve attaches to the ventral aspect of the midbrain. I'll repeat again. Oculomotor nerve is attached to ventral aspect of midbrain. Then what about the 4th cranial nerve or the trochlear nerve? Remember, the trochlear nerve is also attached to the dorsal aspect of the midbrain, but the only difference between oculomotor nerve and the trochlear nerve is oculomotor nerve arises from ventral aspect of the midbrain, whereas trochlear nerve, remember, arises from the dorsal aspect. So we will write it in a different color. This is our 4th cranial nerve or trochlear nerve. Now, why I'm writing this in a different color? I'll repeat again. Trochlear nerve is the only cranial nerve that is attached to the dorsal aspect of the midbrain. Right? This is regarding the first 4 cranial nerves. So we have 2 cranial nerves, oculomotor and trochlear, which are attached to the midbrain. Right? Let's talk about the next nerve. The next nerve is the trigeminal nerve, which usually arises by 2 distinct roots. Right? It has got a motor root and a sensory root. So this is the trigeminal nerve. Right. So trigeminal nerve is attached where? It is attached to the ventral surface of the pons. Right. Then we have a landmark area here. Now, can you identify this? This is known as the Ponto Medlary junction. So we will call this as Ponto Medlary junction, which represents the union or junction between the pons and the medulla. Now, this junction will give attachment to 3 important cranial nerves. Now, let's try to understand what are they. There is one cranial nerve medially. Then there is one in the middle, which again arises by 2 roots. Then there is one laterally. Now, what are these? Remember, this is the 6th cranial nerve. This is the 7th cranial nerve. And here we have the 8th cranial nerve. So what are these? The abducent nerve, facial nerve, and then vestibulocochlear nerve. Where are they attached? Remember, they are attached to Ponto Medlary junction. That is, from medial to lateral, we have the attachment of abducent nerve, then facial nerve, and then vestibulocochlear nerve. So this is how the first 8 cranial nerves are attached to different parts of the brainstem. Now, we are left with cranial numbers 9 to 12. Right? Now, where exactly these cranial nerves, the last 4 cranial nerves are attached? Remember, the last 4 cranial nerves are attached to Medulla Oblongata. Where exactly in Medulla Oblongata? Again, in order to identify this, we need to identify few landmarks. What we have here is, this is referred to as anteromedian fissure. Right? On either side of anteromedian fissure, we have a swelling. This swelling is the pyramid. Right? After pyramid, there is one more swelling, that is olive. Right? And lateral to olive, we can see one more swelling, and that swelling is what we refer to as inferior cerebellar peduncle. Right? So these are the 3 swellings which are seen in the medulla from medial to lateral. Right? Pyramid, olive, and inferior cerebellar peduncle. Now, these are separated by 2 sulci. There is one sulci here and there is another sulci here. Now, what are these sulcus? The sulcus that separates the pyramid and the olive, we refer it to as anterolateral sulcus. The sulcus that separates the olive and the inferior cerebellar peduncle, that is referred to as posterolateral sulcus. Now, why we need to know all this? Remember, the last 4 cranial nerves are attached exactly like this. The first cranial nerve we have here is this. Then we have one more, and then we have one more cranial nerve. Now, what are these? Remember, these are respectively the 9th cranial nerve or the glossopharyngeal nerve. And then what do we have here? This is the 10th cranial nerve or the vagus. And finally, what we have here, this is the cranial root or cranial part of axillary nerve, the 11th cranial nerve. So where exactly is the attachment of 9th, 10th and 11th cranial nerve? Remember, it is into the posterolateral sulcus of medulla oblongata that lies between olive medially and inferior cerebellar peduncle laterally. Right? This is regarding the attachment of 9th, 10th and 11th cranial nerve. So what we are left with? We are left with the last cranial nerve, and the last cranial nerve is attached here to the anterolateral sulcus. And what is this cranial nerve? Remember, this is our hypoglossal nerve. Done? So, where exactly is the attachment of hypoglossal nerve? Remember, hypoglossal nerve is attached between the pyramid medially and the olive laterally to which sulcus? Anterolateral sulcus. Right? This is what you need to know regarding the attachment of the cranial nerves to the inferior surface of the brain. Right? Remember, the first two cranial nerves are attached to forebrain. Then oculomotor and trochlear nerve are attached to the midbrain. Then we have the trigeminal nerve which arises from the pons. Then we have abducent, facial and vestibulocochlear nerve which arises from the junction between pons and medulla or ponto-medullary junction. Then we have the last four cranial nerves, that is 9th, 10th and 11th, glossopharyngeal, vagus and cranial root of axillary nerve, which are attached to the posterolateral sulcus of the medulla, whereas the last cranial nerve or the hypoglossal nerve is attached to the anterolateral sulcus of medulla oblongata. This is regarding the details of the cranial nerve attachments. Right. Once we have learned this, how these cranial nerves will leave the skull or enter the skull. Now, what do I mean by this? Remember, when we are talking about the sensory nerves, they always ascend towards the brain, right? So they need some foramina to enter into the skull. When we are talking about motor nerves, right? These motor nerves have to leave the skull before they supply their target organs, right? That is why they also need some foramina to leave the skull and supply target organs. So how exactly these 12 cranial nerves either enter or exit the skull? Let's try to appreciate this using the interior of the skull. Now, this is an image showing the interior of the cranial base, and we know that this is divided into distinct fossas. So we have the anterior cranial fossa, the middle cranial fossa and the posterior cranial fossa. Let's try to understand how exactly cranial nerves pass through this interior of the skull. First cranial nerve. What do we have the first cranial nerve as? The olfactory nerve. And what kind of nerve is olfactory nerve? As we said, olfactory nerve is a sensory nerve. How exactly it passes through the skull? Remember, it passes through this region. Now, can you tell me what is this plate which is lying in the anterior cranial fossa and shows a lot of openings or sieves? Yes, this is the cribriform plate of ethmoid. So this is the cribriform plate. So the first cranial nerve enters the skull by passing through the cribriform plate of ethmoid. Right, this is regarding first cranial nerve. What about the second cranial nerve? Remember, the second cranial nerve is the optic nerve. Right? So we have the optic nerve. And how exactly optic nerve will enter the skull? Can you identify this foramen? What is this foramen or opening? Now this is the optic canal. Right? So the second cranial nerve or optic nerve will enter through the optic canal. What about the third cranial nerve? Remember, the third cranial nerve, oculomotor, the fourth cranial nerve, which is the trochlear nerve, and the sixth cranial nerve. Right? These cranial nerves supply extraocular muscles. That is oculomotor nerve, trochlear nerve, and then abducent nerve. They supply extraocular muscles, so they have to reach the orbit. And how do they reach the orbit? They reach the orbit by passing through a fissure or a foramen which is present deeper in this region. Right? Now, what is that fissure? Remember, we refer this fissure to as the superior orbital fissure. So, what cranial nerves will pass through the superior orbital fissure? You can remember this as the third cranial nerve or the oculomotor nerve. Then we have the fourth cranial nerve or the trochlear nerve and the sixth cranial nerve or the abducent nerve. Right? Again, I'll repeat. The anatomical basis for passage of these three cranial nerves through superior orbital fissure is they ultimately have to supply the extraocular muscles. So all three cranial nerves, third, fourth and sixth, they pass through the superior orbital fissure. Right. This is regarding 1, 2, 3, 4 and 6. Now where did the fifth cranial nerve go? Remember, the fifth cranial nerve or trigeminal nerve is further subdivided into V1, V2 and V3, which is the ophthalmic nerve, then maxillary nerve, and then we have mandibular nerve. Right? Now, through what foramina they pass? When we talk about the ophthalmic nerve, right? The ophthalmic nerve will further split into the lacrimal nerve, frontal nerve, and nasociliary nerve. Right? All these nerves will again pass through the superior orbital fissure. Right? So this is regarding the fate of ophthalmic division of the trigeminal nerve. Done. What about the maxillary nerve? Remember, the maxillary nerve will pass through a foramen which is present here. Now, can you tell me what is that foramen? Yes, that is the foramen rotundum. So, foramen rotundum will allow for the entry of maxillary nerve. Right. Then what about the mandibular nerve? The mandibular nerve, remember, will pass through this foramen. Now, can you tell me what is that foramen? Huge oval-shaped foramen? Yes, that is the foramen ovale. Right? So, the fate of trigeminal nerve is not like it is passing through a single foramen. The ophthalmic division splits into, as I mentioned, nasociliary, lacrimal and frontal nerves, all of which will again pass through the superior orbital fissure. Maxillary nerve will enter the skull through foramen rotundum, and then we have the mandibular nerve which will pass through foramen ovale. This is regarding the first 6 cranial nerves, how they enter or leave the skull. Then, which is the next nerve? The next nerve we have is the 7th cranial nerve. Which is the 7th cranial nerve? The 7th cranial nerve is the facial nerve. So, how exactly the facial nerve will enter or leave the skull? Now, regarding facial nerve, there is a peculiarity. Let's try to learn. Now, we have a foramen here, and this foramen is referred to as the internal acoustic meatus. Right? The internal acoustic meatus will allow for the passage of the 7th cranial nerve as well as 8th cranial nerve. That is facial nerve and vestibulocochlear nerve. Right? Fine. The fate of vestibulocochlear nerve, it has to innervate the structures of the inner ear, so it does not exit the skull. But the fate of facial nerve is, it has to come out of the skull and it has to supply the structures in the face. So how exactly the facial nerve comes out? Remember, the first thing is, it enters or it passes through the internal acoustic meatus, enters into middle ear, but remember, it leaves through a foramen called as stylomastoid foramen. So this is one peculiarity regarding facial nerve I want you to remember. It enters through the internal acoustic meatus, but it leaves the skull. Right? Remember, it leaves the skull by passing through the stylomastoid foramen. This is regarding the facial nerve and the vestibulocochlear nerve. Then the last 4 cranial nerves. The 9th, 10th and 11th cranial nerve. Right? That is glossopharyngeal, the cranial root of axillary nerve and vagus nerve. They have a common foramina through which they will pass. Right? What are they? Now remember, just beneath the internal acoustic meatus, we have this foramen. Now what is this foramen? This foramen is referred to as the jugular foramen. And jugular foramen will allow for the passage of what nerves? Remember, 9th, then we have 10th, and we have the 11th cranial nerve. Right? This is regarding the 9th, 10th and 11th cranial nerves. Then we are left with the last cranial nerve. Now, how do the last cranial nerve exit? Remember, just beneath the jugular foramen, we have one more opening here. And what is this opening? This is referred to as the hypoglossal canal. And as the name suggests, this will allow for passage of the 12th cranial nerve or the hypoglossal nerve. Right? And if you observe, the last 6 cranial nerves, that is the facial nerve, vestibulocochlear nerve, the glossopharyngeal, vagus, axillary and hypoglossal nerve pass through foramina which are present in a straight line. If you draw a straight line that passes through the internal acoustic meatus, jugular foramen and hypoglossal canal. This is exactly how the 12 pairs of cranial nerves either enter or exit the skull. And this is very often asked in your practical exam as spot a question or discussion topic. So you need to know in detail the attachment to the cranial nerves to the inferior surface of the brain, and also you should know the details of the foramina through which it comes out or it enters. Right? This is regarding the entry and exit of cranial nerves. Right. Once we have learned this, let's try to focus on the functional components of cranial nerves. Now, what do we mean by this? Remember, each cranial nerve is destined to do some important functions. Some cranial nerves are associated with a single function, whereas some cranial nerves have to perform multiple functions. Now, when they have to perform multiple functions, they need to have different kinds of nerve fibers, right? These different kinds of nerve fibers, they tend to arise from different functional columns, different nuclei. And that is what we will learn now. Now, first, let's try to understand the meaning of the term nuclei or the term functional column. Now, remember, when we talk about the neuron, right? The neuron has two distinct parts, right? Imagine it has a cell body and it has processes which could be axon and dendrites. The collection of cell bodies of neurons. When we talk about cell bodies, the collection of cell bodies of neurons within the CNS is referred to as special names, and within the PNS they are called something else. Remember, collection of cell bodies of neurons within the central nervous system can be referred to as gray matter when the collection is diffuse. Right? When the collection is localized, we call it as nucleus. Right? Similarly, when cell bodies collect within the peripheral nervous system, we call it as what? We call it as ganglia. Done? So, when we refer to nucleus from now onwards, remember, we refer to collection of cell bodies of neurons within the CNS which is localized. Now, when this is present as an elongated column, we refer it to as the functional column. Right? Fine. Now, in order to understand the functional columns and different nuclei of cranial nerves, we need to go back to the development of the brain. Remember, the brain develops from neural tube, right? Let's try to draw it. The neural tube has a cranial part which has 3 vesicles, right? And then it has a caudal part which is tubular. The fate of this part is clear. The caudal part of the neural tube will develop ultimately into the spinal cord. Right? That is clear. When we talk about the brain vesicles, as I said, initially there are 3 brain vesicles. These are referred to as the primary brain vesicles. Right? Now, primary brain vesicles could be, this is referred to as prosencephalon. So, this is prosencephalon. Then we have the mesencephalon. Right? And then here we have the rhombencephalon. This is the rhombencephalon. Now, each of these brain vesicles, except the mesencephalon, undergoes further subdivisions. Right? And these are referred to as secondary brain vesicles. For example, the fate of prosencephalon is, it divides into the telencephalon. It is divided into telencephalon and then diencephalon. Right? Then the fate of rhombencephalon is, it divides into metencephalon and myelencephalon. What is the fate of these secondary vesicles? Remember, the telencephalon will ultimately give rise to the cerebral hemispheres, whereas the diencephalon forms the subcortical gray matter referred to as thalamus or hypothalamus. Then the mesencephalon will not undergo any division, so it will not form any secondary brain vesicle. Instead, it gives rise to midbrain. Right? Whereas the metencephalon will ultimately develop into pons and cerebellum. The myelencephalon will ultimately develop into medulla oblongata. Right? Now, when we talk about the brain vesicles, you need to remember what are the primary brain vesicles, what are the secondary brain vesicles, and what are the adult derivatives. From this, we can conclude that when we talk about brainstem, right? The brainstem, as we said, includes midbrain, pons, and medulla oblongata. They develop from mesencephalon and the myelencephalon part of the rhombencephalon, including the pons which develops from metencephalon. Now, why we are discussing all this? When we talk about the functional columns, remember the functional columns are present only for cranial nerve starting from 3rd to 12th. We do not define cranial nerve nuclei or functional columns for olfactory nerve and optic nerve. Right? So, oculomotor to hypoglossal nerve will have functional columns and will have nuclei related to them in the brainstem. That is midbrain, pons, and medulla. Right? Fine. Now, once we have done this, imagine if we are taking a cross section here at rhombencephalon, that is metencephalon or myelencephalon, how does it look? Let's try to draw it. Now, the cross section of neural tube will look something like this. It has a peripheral wall, then it has a lumen. The lumen of neural tube will ultimately give rise to ventricles in terms of the brain. When we talk about spinal cord, the central canal, it persists as the central canal of the spinal cord. Whereas the wall of the neural tube is the one which will give rise to the nuclei and the different tracts arising from them. Fine. As the development progresses, some changes appear within the central canal. Now, what is it? The round-shaped central canal now becomes rhomboid-shaped by the appearance of a groove. We will label the groove. So, this is how the neural tube looks like now. So, from this stage, it passes to this stage where we have the appearance of a groove, and this groove is referred to as the sulcus limitans. Right? Now, sulcus limitans divides the developing neural tube into two parts. Right? The ventral part is motor. So, this is referred to as the motor plate, and the posterior part becomes sensory. So, this is referred to as the sensory plate. Right? So, this is how the section of brain vesicle will look if you take a section at the mesencephalon or any part of rhombencephalon. Further, what happens is with the development of fourth ventricle, right? With the development of the fourth ventricle, there is an expansion of the entire neural tube. How does this expansion occur? Imagine you are cutting through this part of the neural tube and splaying it open, right? Just like you open the book, right? What happens to this section of the neural tube is it looks something like this now. Right? So let's imagine these are the cut ends, right? Where you have made a cut. Truly this cut not will happen, but what happens is this lumen of the neural tube will expand to form the fourth ventricle, and that will give rise to the formation of the neural tube, which appears like this now, right? So imagine this is what? This is the sulcus limitans, this is what? This is the motor plate, and this is the sensory plate. Are we clear? To understand the functional columns of cranial nerve nuclei, understanding formation of this section of the neural tube is very important. Hope this is clear now, right? Fine. Taking this section, we will see how exactly the functional columns make their appearance. Right. Let's draw the section of the neural tube again. As I said, The neural tube looks something like this now. We have the roof of the fourth ventricle, then we have the wall of the rhomencephalon, let's say. And again, so we have, this is the fourth ventricle. And what is this? This is the sulcus limitans. And what is this plate? This is sensory plate, and this is the motor plate. Right? Now, how exactly the functional columns make their appearance? Remember, the first functional columns to appear are appearing close to the sulcus limitans, and these are referred to as, since it is present in which column? It is present in the motor column or the motor plate. So we call this as the efferent column. Right? Now this column is referred to as visceral efferent column. Now what do we mean by this? Remember, the visceral efferent column will supply three structures. These are smooth muscles, cardiac muscles, or glands. So basically, when we talk about the visceral efferent component, they form the autonomic part of the nervous system, supplying either smooth muscle, cardiac muscle, or glands. At the same time, we have appearance of one more column in the sensory plate. And what do we call this? We call this as the afferent column. And since it is present close to the sulcus limitans, we call this as the visceral afferent column. Right? The visceral afferent column, remember, carries the sensation from the same organs. Done. So this is regarding the first column. Then the second column to make its appearance as a column in the motor plate, and we call this as the somatic efferent column. Now what does somatic efferent column do? Remember, the somatic efferent column will supply muscle derived from the cranial myotomes. Cranial myotomes or cranial somites. Right? In the head and neck region, the muscles derived from cranial myotomes include the extraocular muscles mainly. Right? Fine. This is regarding the somatic efferent column. Similar to that, we have one more functional column that appears here. And what do we call this now? This is referred to as the somatic afferent column. Right? Somatic afferent column is responsible for carrying cutaneous sensation from the same structures which are derived from somites. Right. So this is regarding the somatic afferent column. Done. Once this development occurs, simultaneously we have the development of branchial arches which is going on simultaneously. Right? Now development of branchial arches requires a special functional column to supply the structures derived from it. And for this, we have the third column that appears, and we will call this column as the visceral efferent column. Now the question is, we have already a visceral column, right? A visceral efferent column. So they look like the same, right? Now for this, what we do is, we call this column as the special visceral efferent column. Right? What is the function of special visceral efferent column now? Remember, special visceral efferent column is concerned with supplying the muscles which are derived from branchial arches. Right? So once we have special visceral efferent column which develops with the development of branchial arches and supplies the muscles of the branchial arches, we call this column as special visceral efferent. So once we have the special column, we can now call these as general visceral efferent column and this as general somatic efferent column. This is how we have the formation of the efferent columns or the motor columns. So we have the general visceral efferent column which will supply the smooth muscle, cardiac muscle or glands and forms the autonomic component of the nervous system. We have the special visceral efferent column which supplies the muscles derived from branchial arches, and then we have the general somatic efferent column which will supply the muscles derived from the cranial myotomes. Similar to this, the branchial arches also need afferent fibers, and in order to do this, we have one important functional columns appearing here, and we call this as the visceral afferent column. Now again, we have the confusion. We have two visceral afferent columns. So we call the visceral afferent column that carries the sensation from the branchial arches as the special visceral afferent column. And remember, the special visceral afferent column is concerned with carrying taste sensation from the tongue. Right? So once we have the special visceral afferent column, so we can call this as general visceral afferent, and then we can call this as general somatic afferent. So the sensory plate, again, we have three functional columns. General visceral afferent column, which would carry the sensation from the viscera. We have special visceral efferent column, which will carry taste sensation. Then we have general somatic afferent column, which is responsible for carrying general sensation or cutaneous sensation from head and neck region. In addition to all this, the sensory plate will have one more additional column, and we call this as the special somatic afferent column, but this is exclusively related with the 8th cranial nerve, where we have the vestibular nucleus and cochlear nucleus representing only this cranial nerve. We have one single column. Right? This is how the 7 functional columns are formed. So we have 3 efferent columns and we have 4 efferent columns or afferent columns which give sensory fibers and efferent columns which give the motor fibers. Right? So each cranial nerve may contain a single functional column or multiple functional columns depending on its functions. Let's try to learn about these functional columns and what cranial nerve nuclei they represent. Let's use this tabular column to simplify the position of cranial nerve nuclei in different parts of the brainstem. At the same time, we will try to identify what functional components they are associated with. Right? So what we'll do is, we will use this part to write about the efferent column. So we will write all efferent columns here, and then we will write all afferent columns here. Okay, so these will be afferent columns. So what does this represent? Let's say this represents the sulcus limitans. And then here on this side, what we'll do is we will write the midbrain, pons, and then the medulla oblongata. Right? The 3 parts of brainstem from cranial to caudal. Let's always begin with the columns which are present on either side of sulcus limitans. For example, in efferent column, this is general visceral efferent column, whereas in afferent column, this is general visceral afferent. Remember, the general visceral afferent column and special visceral afferent column are represented by same nucleus, so we will write this under single column. So we have general visceral afferent and we have special visceral afferent. Right. Then what about the next columns? The middle column always belongs to the branchial arches, right? So what we have here is the special visceral efferent column, but we have already mentioned special visceral afferent column and general visceral afferent column under a single column because it is represented by a single nucleus, right? So what we have as the next column, we have the general somatic afferent column. What about the last functional columns? We have the special somatic afferent column, which is unique to the sensory plate, and here we have the general somatic efferent column. Done? So let's try to identify the nuclei that are associated with these functional columns. We will begin with the special somatic afferent column, which is concerned with the vestibulocochlear nucleus. So what nucleus it has? Remember, it has a cochlear nucleus and then it has a vestibular nucleus, which is mainly located in the caudal part of the pons and the medulla oblongata. Fine. So what we have here is, this is the cochlear nucleus and let's say this is the vestibular nucleus, both of which are attached or associated with the 8th cranial nerve. Right. What about the general somatic afferent column? Remember, we said general somatic afferent column is concerned with carrying general sensation or cutaneous sensation from the head and neck region. And can you tell me which nerve is concerned with carrying cutaneous sensation from the head and neck region? It is the trigeminal nerve. And the trigeminal nerve has different sensory nucleus. For example, it has something referred to as mesencephalic nucleus. Right? So we call it as the mesencephalic nucleus. Right? Then it has a chief sensory nucleus. So this is referred to as chief sensory nucleus. Then it has something referred to as spinal nucleus. The peculiarity of the spinal nucleus is it extends throughout the brainstem. So let's say this is the spinal nucleus. So spinal nucleus. So what about general somatic afferent column? General somatic afferent column includes mesencephalic nucleus of trigeminal nerve, which is located in midbrain. Then it has the chief sensory nucleus, which is located in pons. Then it has a spinal nucleus which extends throughout the midbrain, pons, and the medulla oblongata. Right? This is regarding the general somatic afferent column. Done. What about general visceral afferent and special visceral afferent column? Remember, when we talk about the special visceral afferent column, it is concerned with carrying the taste sensation. Taste sensation from where? Taste sensation from the tongue. Let it be anterior 2/3, posterior 1/3, or posterior most part of the tongue. The taste sensation from all the three parts is ultimately carried to one single nucleus. And what is this nucleus? This nucleus is referred to as the nucleus tractus solitarius. Right? And nucleus tractus solitarius is located in the medulla oblongata. The nucleus tractus solitarius will also receive the general visceral afferent fibers. Right? So remember, for general visceral afferent sensation and special sensation like taste, there is only one nucleus, that is nucleus tractus solitarius, which is located within the medulla oblongata. Right? This is regarding the nuclei associated with the sensory columns and different nuclei that represented and which part of the brainstem are they located. Now let's talk about the efferent column. First, let's begin with the discussion of general visceral efferent column. As I said, general visceral efferent column is concerned with supplying three structures only: smooth muscles, cardiac muscles, or glands. Now, what nuclei are represented by this? In midbrain, we have a general visceral efferent nucleus, which is referred to as the Edinger-Westphal nucleus. Remember, the Edinger-Westphal nucleus is responsible for supplying the pupillary muscles. Right? So they supply smooth muscles, and that nucleus is Edinger-Westphal nucleus, which is located in midbrain. Fine. This is regarding the smooth muscles. Now, smooth muscles, remember, are also present elsewhere in the body. They are present as component of blood vessels. They are present as components of hollow organs like GIT, urinary tract, respiratory tract. So what nucleus represents this? Remember, this nucleus should also supply cardiac muscles, or this column should also supply cardiac muscles. Now, which is the nerve which innervates the smooth muscles in the body and also the cardiac muscles in the body? Yes, it is the vagus nerve. And what nucleus is associated with vagus nerve and general visceral efferent column? Remember, this is referred to as the dorsal nucleus of vagus. Right? So, dorsal nucleus of vagus belongs to general visceral efferent column, and it innervates all the smooth muscles in the body and all the cardiac muscles in the body. Right? So, we have one nucleus which was supplying smooth muscle. We have one nucleus which is much more extensive in function, supplies both smooth muscles as well as cardiac muscles. Now, are there any glands in the head and neck region which receive innervation? Yes, there are the salivary glands like parotid, submandibular, and sublingual. There are lacrimal glands, there are palatine glands, there are nasal glands, there are a lot of glands. And these have to secrete. And these secretomotor fibers come from different nuclei. What are these nuclei? Remember, these nuclei are referred to as the superior salivatory nucleus, inferior salivatory nucleus, and then we have lacrimetry nucleus. And where exactly these nuclei are located? These nuclei are located within the pons. Superior salivatory nucleus is associated with the facial nerve, it carries secretomotor fibers to submandibular and sublingual salivary glands. Whereas the inferior salivary nucleus is concerned with glossopharyngeal nerve and it carries secretomotor fibers to parotid gland. When we talk about lacrimetry nucleus, remember lacrimetry nucleus innervates the lacrimal glands and this is associated with the greater superficial petrosal nerve, which is a branch of facial nerve. Right. This is regarding the general visceral efferent column. Done. Then let's come to special visceral efferent column. What is special visceral efferent column? As we learned, special visceral efferent column will innervate the muscles derived from branchial arches. Now let's take a minute to recall what muscles develop from branchial arches. Can you tell me what are the muscles of first branchial arch? Good. They are muscles of mastication. What about the second arch muscles? Facial muscles. What about third arch muscle? Stylopharyngeus. What about fourth and sixth arch? These are the cricothyroid, and then we have all the muscles of the larynx and pharynx. Right? So what is the nerve of the first arch? Nerve of the first arch is mandibular nerve, which will supply all the muscles of mastication. So what nucleus should be associated with this nerve? Now remember, mandibular nerve is associated with the trigeminal nerve. And for trigeminal nerve, we already identified 3 cranial nerve nuclei. What are they? One is the mesencephalic nucleus, chief sensory nucleus, and spinal nucleus, all of which were sensory. Now, what is the motor nucleus of the trigeminal nerve referred to as and where exactly it is present? Remember, it is located in the pons and we call this as the motor nucleus of trigeminal nerve. Right? So we have the motor nucleus of trigeminal nerve which will innervate the muscles of mastication. And this is present in pons and belongs to special visceral efferent column. Similarly, when we talk about the second arch muscles, the second arch muscles are the muscles of facial expression and they are innervated by facial nerve. So what nucleus represents it? Remember, it is represented by the motor nucleus of facial nerve. So this is for the trigeminal nerve and this is for facial nerve. Both the nuclei, remember, are located in the pons. Right. Then what about rest of the muscles? Remember, the third arch muscle is stylopharyngeus, which is supplied by glossopharyngeal nerve. Then we have the fourth and sixth arch muscles, which are the muscles of larynx, which are basically innervated by either cranial part of axillary nerve or vagus nerve. For all these muscles, starting from stylopharyngeus, muscles of the larynx, there is one common nucleus and we refer this nucleus to as nucleus ambiguus. And nucleus ambiguus, as we see, is situated within the medulla oblongata. Remember, nucleus ambiguus is a common nucleus which will innervate the stylopharyngeus and also the muscles of larynx. Done. This is regarding special visceral efferent column. The last column that we are left is general somatic efferent column. Remember, general somatic efferent column will supply the muscles derived from the cranial myotomes. Now remember, in the region of head and neck, the cranial myotomes gives rise to extraocular muscles, and apart from extraocular muscles, it also gives to the muscles of the tongue. Let's talk about extraocular muscles. Right? Now, extraocular muscles, as we know, have recti and obliques, and we all know the mnemonic, right? LR6, SO4, and rest by 3. That is, lateral rectus is supplied by LR6, that is abducent nerve. Superior oblique, SO4, it is supplied by trochlear nerve, and all other muscles are supplied by the oculomotor. So the cranial nerves that are associated with supplying the extraocular muscles are oculomotor nerve, then we have trochlear nerve and abducent nerve. Where exactly these nuclei are located and what are they called as? Remember, we have the oculomotor nucleus which lies within the midbrain, and then we have the trochlear nucleus which lies within the midbrain, and then we have the abducent nucleus which is located within the pons. So oculomotor and trochlear nerve nuclei are located in midbrain, whereas abducent nerve nuclei is located within the pons. Then What about the medulla oblongata? Does it contain any nucleus? Remember, apart from extraocular muscles, I said the muscles of cranial somites include the tongue muscles which develop from occipital myotomes. And as we know, these are supplied by the hypoglossal nerves. Right? So what nucleus is associated with this? We call this as the hypoglossal nucleus. And where is it present? It is present in the medulla oblongata. Right? Now here we have the complete picture of the cranial nerve nuclei, where they are present and what functional columns they are associated with. For example, if I ask you, what are the functional columns or functional nuclei associated with the general somatic afferent column, your answer would be, it includes the oculomotor nucleus, trochlear nucleus, abducent nucleus, and then hypoglossal nucleus. Right. Imagine my question is, what are the cranial nerve nuclei that are present in midbrain? You can see cranial nerve nuclei present in midbrain include the oculomotor nucleus, trochlear nucleus, Edinger-Westphal nucleus, and also mesencephalic nucleus. Similarly, when we talk about pons, pons has abducent nucleus. It has the nucleus of the motor nucleus of trigeminal nerve and motor nucleus of facial nerve. It includes superior salivatory, inferior salivatory, lacrimetry nucleus. Then it also has the chief sensory nucleus of trigeminal nerve along with extension of spinal nucleus of trigeminal nerve. When we talk about medulla oblongata, it has hypoglossal nucleus, nucleus ambiguus, dorsal nucleus of vagus, nucleus tractus solitarius, the spinal nucleus of trigeminal nerve, and also includes the vestibular nucleus. Right? So, if you can write this table, if you understand this concept, you can write the functional column for any cranial nerve. You can identify cranial nerve nuclei for any functional column, and you can also recall in which part of the brainstem they are located. Right? This is regarding the details of the positions of the cranial nerve nuclei with respect to the brainstem and with respect to their functional columns. Right? Fine. Once we have done this, let's try to identify this in an actual specimen of the brainstem. Right? As we have learned, this is the limit of the midbrain, and this is the pons, and till here we have the medulla. So what are the nucleus that are present in midbrain? Let's try to recall. Now we know that midbrain has the motor nucleus for oculomotor nerve. So let's say this is the oculomotor nucleus. Then it has trochlear nucleus, right? Apart from oculomotor nucleus and trochlear nucleus, it also contains what? Edinger-Westphal nucleus, right? And there is one sensory nucleus, and what is that? This is the mesencephalic nucleus, right? In addition to this, we said throughout the extent of the brainstem, we have one common nucleus. Can you tell me what is this? This is the spinal nucleus. Similarly, when we talk about pons, pons, remember, has the motor nucleus of trigeminal nerve, then it has motor nucleus of the abducent nerve, and it also has the motor nucleus of facial nerve. In addition to this, it also contains superior salivatory nucleus, inferior salivatory nucleus, and then lacrimetry nucleus. These are the efferent nuclei. When we talk about the afferent nuclei, remember the main afferent nuclei present here is the chief sensory nucleus of trigeminal nerve and also part of the cochlear nucleus. Right. When we talk about the medulla oblongata, remember the medulla oblongata has the hypoglossal nucleus, right? Then it has the nucleus ambiguus and also has the dorsal nucleus of vagus. In addition to this, it has nucleus tractus solitarius, then it has the vestibular nucleus, and it also has the spinal nucleus. Right? This is how we locate the position of different cranial nerve nuclei in different parts of the brainstem. Right? This concept is very important to understand the anatomy of cranial nerves right? The fibers that come from cranial nerves, and this is also important in view of your exams, right? Both your theory exams as well as entrance exams. There are a lot of questions that are frequently asked, especially in entrance exam, based on this concept, right? Fine. This is regarding the position of cranial nerve nuclei as identified in the specimen of the brainstem, right? Once we have learned this, let's try to assess ourselves whether what we have learned we have really understood or not, right? To do this, what we'll do is we will select one cranial nerve and we will try to identify the functional components present in it, right? For example, let's start with a simple nerve, okay? We'll take the trochlear nerve. Now, help me in identifying the functional components that are present in trochlear nerve. In order to do this, the first thing you need to remember is whether trochlear nerve is sensory, motor, or mixed, right? Now, recall the mnemonic. Some say marry money, but my brother says big brains matter most. Based on this, we say trochlear nerve is purely motor. So when we write the functional columns, okay? Now let's say here are the functional columns: general somatic efferent, then we have special visceral efferent, and then we have general visceral efferent, right? When we talk about the afferent columns include general visceral afferent, special visceral afferent, we have general somatic afferent, and special somatic afferent. Now, once I say that the trochlear nerve is purely motor, these columns are ruled out. So it will not contain sensory columns. What about these efferent columns? Which efferent column is associated with trochlear nerve? Now let's try to recall what is the function of trochlear nerve. Trochlear nerve supplies superior oblique, which is one of the extraocular muscle. And we know extraocular muscles are derived from cranial somates, right? Now, if they are derived from cranial somates and trochlear nerve is innervating this muscle derived from cranial somate, it should be represented by which functional column? Yes, it is the general somatic efferent column, right? Now, will it supply any muscle derived from branchial arch? No. The mandibular nerve, then facial nerve, glossopharyngeal nerve, and vagus nerve. These are the only 4 cranial nerves that are concerned with supplying the muscles derived from branchial arch. So there is no special visceral efferent column. Then, will it supply any smooth muscle, cardiac muscle, or gland? The answer is no again. So there is no general visceral efferent column. So the only functional component associated with trochlear nerve is the general somatic efferent column, right? Fine. Now this is for one easy nerve which was like purely motor. Now let's try and do this for facial nerve, which is much more complicated. So what type of nerve is facial nerve? Facial nerve is an example for mixed nerve. So it should have both efferent component and it should have the afferent component. So we cannot rule out any component as such alone here, right? So what we'll do now is we'll try to identify each functional columns. One functional column that you can always rule out for all cranial nerves except vestibulocochlear nerve is the special somatic afferent column, which is concerned only with the vestibulocochlear nerve. Right? Done. Now let's try to identify the functional columns of facial nerve. What is the function of facial nerve? Facial nerve innervates the muscles of face. Right? So what functional columns it should have? Yes, it should have special visceral efferent column. What are the other functions? Facial nerve is responsible for innervating the submandibular and sublingual salivary glands and also the lacrimal gland. So what functional column it should have? What column carries secretomotor fibers to glands? It is general visceral efferent column. Right. What about other functions of facial nerve? Remember, facial nerve through chorda tympani will carry taste sensation from the anterior 2/3 of the tongue. And this is represented by the special visceral afferent column. What are the other functions? Facial nerve also carries small area of cutaneous sensation from the external ear, which is carried by the general somatic afferent column. So it should have a general somatic afferent column. Right? This is regarding the functions of the facial nerve and what are the cranial nerve component or functional components present in the facial nerve. Right? So what are the columns that are not present? The general somatic efferent component and also general visceral afferent component. Right? This is how we arrive at the functional components present in each cranial nerves. Once you know the function of cranial nerves, arriving at these functional components becomes a lot easier. So there is no need to mug up the functional components present in each cranial nerve. Instead, you understand the concept behind how these functional columns are organized, you will get the answer. Right? Fine. Let's try to quickly summarize now. We learned that there are 12 pairs of cranial nerves, out of which the first 2 pairs are attached to the forebrain, the last 10 pairs are attached to the brainstem. And these cranial nerves can be grouped as sensory, motor or mixed. When we see the inferior surface of the brain, as we have seen here, we have the olfactory nerve which is attached to the forebrain. Then we have the optic nerve, right? Then we have the oculomotor nerve which is attached to the midbrain. Then we said trochlear nerve is the only cranial nerve which emerges from the dorsal aspect of the midbrain. Then we have the trigeminal nerve which was arising by 2 roots which was attached to the ventral surface of the pons, and close to Ponto Medlary junction we had 6th, 7th and 8th cranial nerves. That is abducent, then we had facial and vestibulocochlear. To the medulla oblongata, in the posterior lateral sulcus we had the glossopharyngeal, then we had the vagus and the cranial root of axillary, which was attached to posterior lateral sulcus present between the olive and inferior cerebellar peduncle, and then we had the hypoglossal nerve which was attached to the anterior lateral sulcus between the pyramid and the olive. This was regarding the attachment of cranial nerves and classification. Then we learnt about the exit or entry of these cranial nerves. We learned that the first cranial nerve passes through the cribriform plate of ethmoid. The second cranial nerve passes through the optic canal. The third, fourth and sixth cranial nerves, they pass through the superior orbital fissure. Then the trigeminal nerve divides into 3 divisions. What are they? Ophthalmic, maxillary and mandibular. Ophthalmic division splits into nasociliary, lacrimal and frontal, which again passes through the superior orbital fissure. Then we have the maxillary division that passes through the foramen rotundum, which is present in front of foramen ovale. Then we have the mandibular nerve, which passes through the foramen ovale. Right? This is regarding the first 6 cranial nerves. Then we talked about the facial nerve entering through the internal acoustic meatus along with vestibulocochlear nerve, and we also learned that the facial nerve comes out of the skull through stylomastoid foramen. Just below the internal acoustic meatus, we have the entire jugular foramen, which will allow for passage of the 9th, 10th and 11th cranial nerve, glossopharyngeal, vagus and axillary nerve. And lastly, we had the hypoglossal canal, which was lying right below the jugular foramen, and that would give rise to the exit of the hypoglossal nerve. After this, we learnt about the functional components of cranial nerves, where we said the cranial nerves will have 7 functional components: general visceral efferent component, special visceral efferent component, general somatic efferent component. These are the efferent columns. Then for afferent columns we had general visceral afferent, special visceral afferent, general somatic afferent and special somatic afferent. We discussed the different parts of the brainstem, midbrain, pons, and then medulla oblongata, and how these cranial nerves are situated in this. First, we talked about special somatic afferent column, which includes the cochlear nucleus and then the vestibular nucleus, right, which is located in pons and the medulla. Then we talked about general somatic afferent column, concerned with carrying the general sensation from the head and neck, and these are the nuclei represented. It has mesencephalic nucleus of trigeminal nerve, then it has the sensory nucleus of trigeminal nerve, and then it has the spinal nucleus of trigeminal nerve, which extends throughout the length of the medulla oblongata. Then we talked that special visceral afferent column carries taste sensation from the tongue. General visceral afferent column carries the sensation from the viscera. And there is only one nucleus represented, that is nucleus tractus solitarius, which is located in the medulla oblongata. Then we talked about the general visceral efferent column, which supplies smooth muscles, cardiac muscles and glands, and this is represented by the Edinger-Westphal nucleus, which is present in the midbrain. Then we have the superior salivatory nucleus, inferior salivatory nucleus and lacrimetry nucleus, which are present in pons. And then we have the dorsal nucleus of vagus, which is located within the medulla oblongata. Then we talked about special visceral efferent column, which supplies the muscles derived from branchial arches, and we said that for these we have the motor nucleus of trigeminal nerve. Then it has motor nucleus of facial nerve, which supplies the muscles derived from second pharyngeal arch. Then we have the common nucleus referred to as nucleus ambiguous, which is common for glossopharyngeal, vagus and cranial root of axillary nerve. Right? This is regarding special visceral efferent column. Then we have the general somatic efferent column, which will supply or innervate the muscles derived from cranial myotomes. And this includes the oculomotor nucleus in the midbrain. Then we have the trochlear nucleus. Then we have the abducent nucleus, which is located in pons. And then for the medulla oblongata, or in medulla oblongata, we have the hypoglossal nucleus. Right? This is regarding the different functional columns, the different nuclei represented in each functional column, and regarding its location. Right? This is regarding the detailed anatomy of the cranial nerves, their classification, their functional columns, location and functions of their nuclei. That's it for this session.